Good afternoon, everyone. Thank you for joining us today for the HCCN Learning Session webinar. Today's agenda will cover two topics. The first one is the development of health center-specific individualized HCCN work plans, which include at least two goals relating to core goals of both the network and the health centers. And second, a presentation of the most updated FQHC quality measure reporting crosswalk developed by the HCCN that will provide reporting tools associated with meaningful use, PCMH recognition, HRSA UDS quality incentive programs, as well as Medicaid payer quality incentive programs. We will take a deeper dive into both of these topics at the face-to-face HCCN learning session on Wednesday, October 19th in New Orleans. If you've not already done so, please register for that session today on the LPCA website. While space is limited, we are not yet at full capacity, so we'll open up the registration for centers that would like to bring more than 3 individuals on this coming Monday. I'd like to welcome our two presenters today, Jack Milway from our HCCN collaborating organization LPHI, and Doreen Chang, LPCA's data analyst through the CDC Public Health Associate Program. Should you have any questions during either presentation, please submit them through the questions box on your screen. Jack, will turn the program over to you now.
Great. Thank you, Christine, and hello to everybody. As Christine said, if you have any questions at any time, type them into the chat box, and I will answer them at the end of this portion of the session. So, as Christine mentioned, we are here today to talk about I'm here to talk about the individual work plans that y'all will be doing for the HCCN network. We've been going around the state having individual site visits with multiple ones of you, and I'm sure I've met with plenty of you, and plenty more of you we have scheduled visits. However, one of the very important components of the HCCN cycle this time that's very different than the last cycle is the inclusion of this individual work plan for all of the participating health centers. One of the requirements for our grant is that we have individual work plans from all of our participating health centers within the first 90 days of the program. So we have to have these completed and filled out with any questions answered by the end of October. So with that in mind, we have a due date of Thursday, October 13th. That's to give us time on our side to review them, ask any follow-up questions we have, as well as put together any commonalities or pull out any ideas or trends that we see inside of y'all's individual work plans for a deeper dive and discussion at that HCCN pre-conference day, as Christine mentioned, that is on the 19th of October. So the first thing that we wanted to kind of talk about was what are the benefits for having these individual work plans. So the first benefit is the idea of the goal identification and target setting that kind of having a work plan allows us to do. We have a network-wide work plan of the activities that we're going to be doing for the next year and throughout the course of the HCCN. However, having each of y'all set your individual work plans will allow us to better identify peers, identify which groups are all working on individual segments of our different work plan across all of its areas, and better tailor our content to meet your interests and meet whatever you are interested in working on at that time. A tool like this will be able to better identify speakers, better identify activities, and connect you with one another so that all of us are able to kind of synergistically work together on achieving all of the network's goals. So, what are the components of those individual work plans? We have a template that I think has been sent out to all of you. If you have not gotten a copy of the template, I would say check with other individuals in your organization, and someone else might have it. You can also type into the question box if you would like a copy of that template, or we'll be happy to send that at any time if you just shoot one of us an email. The components that we would like on those individual work plans will be at least 2 goals for your health center to be working on for the next year. Those goals will need to be aligned with the core measures of the HCCN, which we're going to go over in just a second. And then we would want at least one of those goals to specifically focus on one of the UDS Healthy People 2020 clinical quality measures. And we'll also go over what those look like in a minute. So we've talked about this before at the April learning session and then again at our site visit, but just as a bit of a review, we will keep coming back to this information. These are the focus areas for our HCCN grant and the areas that we are held responsible for this grant. Those areas include adoption of electronic health records, advancing meaningful use, which I'm sure is a big area for a lot of you and an important touchstone for this program as well as y'all, and is a great opportunity for y'all to put something around that on your individual work plans. Then additionally, we have data and quality reporting. The first one of data quality, increasing the percentage of participating health centers that electronically report their UDS. Currently, that is an incentivized measure for UDS. BIPIC pays health centers an incentive payment for doing that and has for the past couple of years. But we know on the 2017 UDS report that will move from being something that is incentivized to something that HRSA is actually going to be requiring our health centers to do. So that measure especially is something that for those of you who are not doing whole population electronic reporting, we will be providing a lot of activities around that moving forward and might be something that you would want to put on your individual work plan. Other areas include generating quality reports at the site and clinical team level and integrating data from different service types such as your behavioral health system being inside of or what kind of connectivity you might have to your dental health record system from your EHR. Other activities include health information exchange, which is both the connection to a health information exchange in the state, which would be the LAHI or NOHI platforms, which many of you are connected to or in talks with and are familiar with. But we are also looking into different types of health information exchange to facilitate moving data such as direct mail so that y'all are able to talk better with anyone that you're doing referrals to, or more smaller practices, or at least communicating in between each other, not just directly to hospital systems. And then lastly is the quality improvement objective. This is where that Healthy People 2020 measure is going to be. The goal for the network is that we have to increase the percentage of health centers that meet or exceed the Healthy People 2020 goals on at least 5 of the 8 UDS measures that crosswalk to Healthy People 2020. Currently, we don't have any health centers in the state who are meeting at least 5, which is why on these individual work plans, we want all of the health centers to pick at least one UDS quality measure that they're going to work on to meet that Healthy People 2020 goal, so that over the course of the 3-year program, we can reach up to getting 5 measures that each health center is kind of meeting. There's also a measure about increasing the value, efficiency, and effectiveness of health center services, which relates to those UDS Quality Improvement Awards that y'all just got last month. Doreen will talk a little bit more about that later. And then lastly is about increasing the percentage of FQHC sites that have PCMH recognition. If you're interested in that, please feel free to reach out or ask any questions. We know that those requirements are changing pretty substantially for NCQA inside of 2017, and that a lot of you are going to be up for renewal sometime soon. So that would also be an area that would make sense for y'all to put on your individual work plans. The next thing that I wanted to touch on is what actually those Healthy People 2020 UDS measures actually are. So these are the 8 UDS measures that map to the Healthy People 2020, along with what those Healthy People 2020 goals are. We know many of you in the state are working on colorectal cancer screening. We've heard a lot of interest in that. We also know that even in the past iteration of the HCCN, we worked a lot on hypertension, blood pressure control, and diabetes control. So those measures are measures that are kind of carrying over. Newer measures that we've done less with include childhood immunizations, dental sealants, and access to prenatal care and the low birth weight measures. We've seen some interest in working on those as well. We are happy as long as people are working on at least 1 or 2 of these measures each year inside of the program, with the goal of ultimately meeting, again, 5 of these 8 measures meeting that Healthy People 2020 target. If you have any further questions about these measures or how they're calculated or anything like that, we will be doing a deeper dive into that kind of information at the learning session in a couple weeks. So I wanted to kind of give a couple examples of what some example topics might be that you would be interested in doing this. Meaningful use is always a great one. I know that this is the last year for people to sign up their providers to join the Medicaid Meaningful Use Program. So for those of you that might be newer FQHCs or have newer providers or have just switched EHRs and are just now getting ready to be able to do meaningful use, this is definitely something I would say would be a high priority for a work plan, since this is the last year that it's possible to sign up. That can be anything from doing the actual attestation, setting up the patient portal would be another good objective, or even links connectivity to the immunization registry. We've talked with a lot of y'all about the issues connecting to links. We hear you loud and clear and are trying to figure out what we can do to help facilitate that information. And if that's a priority for y'all and something you would want to put on your work plan, then we definitely are happy to work with you on that. For data reporting and analytics, we know it's a network priority, and a lot of you are already going down this path. The implementation of a data solution software, whether like an EHR overlay or an analytics tool, or pull out that electronic reporting for UDS, or analyze that data at a site or clinical level. Both of those are HCCN priority areas and might align with work that you guys are already planning on doing. Similarly to development of UDS Measure dashboards, so that y'all are better able to track or do quality improvement projects on those measures. Lastly, there's just good old-fashioned quality improvement PDSA cycles. Some good measures for that might be colorectal cancer screening, cervical cancer screening, diabetes, hypertension, all of those different types of measures and different Plan, Do, Study, Act or quality improvement project cycles. All of that also fits on the work plan. One important point that we really wanted to make clear is the point of this network is we are here to supplement and assist y'all in your current ongoing activities as they relate to the network. So whenever possible, it's best for you and it's best for us if you align the work that you're doing on this work plan with work you are already performing. If you're in a different initiative that's working on one of our quality measures, that work is exactly what we would love for you to do on your work plan, and we were happy to supplement that work however we can. The last thing we want to do is have y'all creating a whole bunch of duplicative or new projects. For this, we're here to help y'all, not create new work. Lastly, I wanted to go over a little bit of what that work plan template and an example filling out of what that work plan might look like. So as you can see, this is what the work plan template looks like. There's a place for y'all to put what goal you were wanting to work on. Then the HCCN focus areas addressed. If you're unsure which areas your goal is addressing, we're happy to help you fill this out or help you fill this out in any way that's necessary. Add in any different focus areas. You might be hitting multiple focus areas on an individual goal. I'll show you what that looks like as well. The measure of effectiveness, if you're picking the quality measures, it's pretty cut and dry what your measure of effectiveness is, because it's just the performance on those UDS quality measures. Similarly with meaningful use or patient-centered medical home accreditation, those measures of effectiveness are pretty clear. But if you have any questions about filling out this work plan, don't hesitate to ask any questions both in this phone call or later on. Then down below, we wanted to know just some current objectives or the activities you're planning to do and the person responsible for how you plan on addressing these goals over time. So if some of these goals might be very large, long-reaching projects that might take a while, so it's important to break down those objectives and who's going to be responsible for that, both for your own accountability and to kind of set some timelines there, but also it just lets us know whenever we're trying to figure out who we need to loop in on different information or who's the best contact person for different ideas or learning sessions or webinars that we're going to be doing. Who that person responsible is for different things will kind of give us a better idea of who we need to route information to as well. So some important notes in terms of what I think is going to be really important for this is making sure that your goals are SMART, which is to say that your goals are specific to what you're actually wanting to accomplish. making sure you have the measure of success inside of those, setting goals that are attainable, not that we're going to have 100% hypertension control within the next 6 months, making sure those goals are relevant, not just to our project, but to what your current activities are, and then lastly, making sure things are time-bound. That's as much just to set kind of a timeline of how things are happening, as well as the expectations. Sometimes timelines can either be too long or too short, but setting them on the front end is going to be what kind of sets that expectation of when work needs to be accomplished. Another important note is to remember that this is a team project. As we've been going through this, we've been identifying not just a main point person, but the other individuals who might be on your organization's change team. A lot of these projects across a lot of different areas, we touch a lot of different things inside of this network, from IT capacity to clinical workflows or clinic management, just to data reporting and analytics. And so it's important to make sure you get all those different perspectives on the different work, not just kind of tackle it from one angle. Breaking down those large activities into smaller tasks is also going to be very important. As I mentioned earlier, some of these things that y'all might be working on might be very large, complex, different things. If you're working on hypertension control, there's going to be something that might relate to customizing the EHR, to creating and looking at a registry, all the way down to changing a workflow or calling those patients to come in. All of those different things all fit into this, and it's going to be different people doing that. So the more you're able to kind of assign different people to that and understand who would do what, it's going to be really important, and that's going to be a key to success. Lastly, don't just set this work plan and forget about it. The whole point of doing this so early in the year and early in the project is going to be this individualized work plan is going to be a document that we hope y'all will continue to revisit and update throughout the life cycle of the HCCN program, so that as you add new objectives or cross stuff off, this is going to be a document that we keep coming back to so that we have a good idea of what y'all are working on at any given point in time. So really don't just treat this as kind of like a homework assignment. We want y'all to also use this as a tool that you're going to be reviewing and following up on, because we'll be asking you about it moving forward. So I wanted to include a draft goal here of what something might look like filled out for a clinical goal, and then I also wanted to show what one would look like for an operational goal. So as you can see inside of this goal, Achieve Healthy People 2020 goal of 70.5% for colorectal cancer screening on 2016 UDS report. That's a SMART goal. It's a specific, measurable, attainable, relevant, and time-bound goal. So that's what we're really looking for in those goal statements. It lists what HCCN focus areas this addresses. The measure of effectiveness is that UDS quality measure. And then we have some specific objectives, activities, and people responsible. We have one that's kind of an ongoing annual review thing, and then a couple other items that have set dates of when we kind of hope that that stuff is going to be done. So I think both things in terms of that completed by date are both relevant and useful. I just wanted to give you guys kind of an example of what this might look like, so when you're filling it out, you kind of have a template to go off of. Here is a second example. This is more of an operation, not like a clinical quality measure. This is about meeting meaningful use attestation. Similarly, it's a SMART goal, increasing the number of providers successfully attesting to the program to 75% for 2016. We mentioned what core focus area it is meeting there, as well as the measures of effectiveness, which is the number of people receiving those payments, and then some objectives and some activities. Another thing that's relevant here is for one of these objectives, this tracking provider progress and attesting to meaningful use, this objective 2, in addition to being an important goal for the core objective area 2, which is the meaningful use attestation, that tracking provider progress really meets a lot of other HCCN goals too. That would be reviewing information at the provider level, being able to pull that information electronically. So there's a lot of different ways that you can meet those HCCN objectives just by creating goals. The HCCN objectives are really about how best are you using health IT to improve your quality of care, which as we know is most projects we're doing on touch on that in some way. So there's probably a really easy way to meld whatever your current projects are to be meeting and be relevant to these HCCN goals. And if you have any questions about how best to do that, feel free to ask any questions in the chat box or follow up with us later. That's the end of what I had to present to y'all right now. I wanted to open it up to questions briefly before I turned it over to Doreen to talk about the clinical quality measures. So do we have any questions?
I had a couple people ask me this, so I'll just make a general announcement. In the handout section, there is the PowerPoint, the crosswalk, and also the individualized work plan in Excel form for the template. So if you go there, you can find all these documents.
Yeah, absolutely. And I guess another important point is, for those of you that this is the first time you're seeing this, if you have any further questions or you would want to schedule any time to kind of talk through this, or you would want any extra assistance in kind of filling this out, or like trying to figure out what your current activities and how they might fit into this are, feel free to send us an email. I'm happy to schedule time and talk with y'all over the next week and a half to try and figure out how to get this in and what we can do to kind of help, as well as continue to talk about it at the learning session at the annual conference too. Doreen, were there any other questions?
Nope, none so far.
Okay. Well, that's what I had to show y'all about the individual work plans. We look forward to beginning to review those coming in over the next week or so. And for those who are having any questions or issues, I'll be reaching out next week to follow up and make sure we're getting these in and answer any questions y'all have. So thank you so much for your time. And now I'm going to hand it over to Doreen to talk about the clinical quality measures crosswalk.
Okay. So we're going to switch gears a little bit, but it's still like very related to the work plan. So we introduced this crosswalk back in the April learning session, and since then I've made a couple updates based on feedback, and I've also just added some new updates based on changes to meaningful use or any clinical quality measures. So this is the first page of the crosswalk, and it's really just like a brief instructions page. If you have any questions or want to say anything, my contact information is also on there. I know I send you all like a million emails, so if you want to get back at me, you're free to send me a lot too. This is kind of the main portion of the crosswalk. The clinical quality measures, there's about 75 of them. On the left, you'll have the CMS number and the NQF number. So it's primarily organized by these two sections. The NQF number, it's mostly in numerical order, but it's a little bit mixed around. I know that's not great, but it's the best way to organize this giant list of measures. Then we'll have the measure domain, which is kind of what CMS has designated as that measure domain, and it's used in a couple different places, so I thought it was an important aspect to keep in here. And then the next three sections are the measure description, the numerator, and the denominator, and that's usually how it's defined by the measure steward, whether it's like NCQA or CMS or whoever that is. I try to pull it from their page as closely as possible. So if you click on one of these NQF numbers, it's hyperlinked to the National Quality Measure Clearinghouse page, and then it'll show you like all the different versions so you can kind of get more information. And that was a comment that we got during the time. So it'll give you like this description rationale if you really want to go more in depth into it. If you don't want to, it's fine. It's just there for your reference. So the main categories we have are the meaningful use clinical quality measures, the UDS measures, PCMH measures, PQRS cross-cutting measures, and then the 3 IPA contracts for your Medicaid plan. So for meaningful use, PCMH and PQRS, It's a list of possible measures, and you don't have to report on all of them. They kind of just ask you to pick a couple to report on. So the P just means that it's like you can pick a couple from all these measures, and they'll have more descriptions about like what categories you need, and that's kind of what we're going to touch on later with some of the other tabs that are at the bottom. For UDS, what I've done is they're obviously all required. You all know that, like, you have to report on these measures. So the number in parentheses is this benchmark that they have for the National Clinical Quality Measure, the National Clinical Quality Leaders Award for the HRSA Quality Improvement Awards. And then some of them also have this little red spot in the corner, and that is the Healthy People 2020 goal. And so the 8 measures that Jack talked about earlier that we're focusing on, they'll have this little red sticker with the note attached of what the Healthy People 2020 measure is, in case you want to go through and have that on hand when you're looking through this. And then the only other one that has a note like that is in AmeriGroup, where the note is for the measures that are included in their payment program. So they have like 13 required measures that they work on, but only 4 measures are included in their payment program. So that's something we've added as that's become more clear. And because this is kind of such a giant list of measures, one of the functions I've added is that you can click on the sort button and go to filter by color, and if you choose the light green, it'll show you only measures for UDS, so you can kind of more easily see what those are and what they overlap with as well. So that's just like basically how you use it. If you want to look at UDS and like AmeriGroup, you can filter by color in both of those, and it'll show you like what measures exactly are in those 2 sections. Let's clear filters. And kind of one of the purposes of the crosswalk is kind of to just show where the alignment is between clinical quality measures. So if you choose something like cervical cancer screening for your goal, you can kind of see that you're hitting a lot of other objectives as well. Like you can report on it for meaningful use. You can report on it for PCMH. It's one of AmeriGroup's payment measures. It's just kind of a tool to show you or any providers that you have in your organization, like there's a real purpose to kind of doing these reports and taking that time. And some of these other tabs, the first one is for like a sample meaningful use attestation. So for the meaningful use requirement on clinical quality measures, you have to pick 9 of these possible measures from 3 different domains. And so what we've done in the sample meaningful use tab is kind of given you 9 different measures from 3 different domains that also cross over with like UDS or other standard reporting measures that you have to do for any of those other projects. And so it's just like as an example there, if you're looking for something really specific, and PCMH is kind of a similar situation, like they have some really specific reporting requirements, and theirs are like 2 different preventative care services, 2 different immunizations, 3 different chronic or acute care services, and then medication monitoring is kind of the categories that we've put here. So this is just like another example of measures that cross over with a lot of other reporting requirements. And if you're looking, if this is like the first year you're looking to be recognized for PCMH and you need more help with like picking measures or figuring out which ones to choose, this is kind of a good reference point. The last tab is the HRSA Quality Improvement Awards. So I just updated it based on the webinar they had yesterday. So this kind of outlines all the different awards to the best of my ability with the award description and then the criteria they use and the dollar amount. Some of them are a little trickier, and I don't have the exact like criteria, such as like the health center quality leaders, because they risk stratify and HRSA doesn't really tell you how exactly they're doing it, only like what goes into it. So that can be a little tricky. But it just has like the dollar amounts and just kind of a brief overview for when you need it. For the 2 newest awards, we're still looking at hoping HRSA gives more information because it wasn't that clear yesterday, but for right now, this is kind of what they said, and then I'm sure we're going to expand on it during the learning session in the pre-conference learning session, so we'll hopefully know more by then if you have any questions on that. But that's kind of the basic outline of the crosswalk. Does anyone have any questions?
Doreen, we're not showing any questions yet showing up in the questions box, but I did want to take a moment while, and if anyone wants to submit a question via that, you can. I did want to take an opportunity to say that if you have any sample suggestions that we can add to the ones that we've already put in here that might be beneficial for other health centers that have and have worked well with you, particularly in the examples of the meaningful use and PCMH reporting, feel free to submit those to us, and we'll incorporate all those suggestions into this living, breathing document that is really quite flexible to the needs of many things that y'all are working on. And the last point I wanted to make is specific to the payer measures for their quality incentive award programs. For AmeriGroup, we only have the ones that are contracted through the Provider Health Link of Louisiana, which is the PCA's IPA, included in this, although we will attempt to get the other payers as we sign them, and or if there is no signing of contracts with them, we'll still try to get them to make this a comprehensive document. But I did want to note that these payer, the goals that they put in there are based on a huge amount of selective criteria that's given the payers, and those will change on a fairly regular basis. What's the top focus areas that each plan is looking for will change according to their own internal decision making on those. So we will try to keep them as updated as possible, and they may not. So that's what I wanted to say about that. I still don't see any questions coming in, so just as a reminder, we do have the slides and the Excel spreadsheets available in the handout section of today's presentation. If you, for some reason, cannot access that, then please just send us an email and we'll shoot the documents off to you. So thank you all for joining us this afternoon, and we look forward to seeing you at the learning session on October 18th. Have a good afternoon.